And a new study today says seniors who have not had COVID-19 are the group most at risk for dangerous outcomes if they do get the virus. That report has just been published in the Journal of the Canadian Medical Association. The CBC's Lauren Pelly has those details.
Well, new data out today paints a picture of just how many Canadians might have caught COVID-19 by now, and why certain groups may still remain very much at risk of this virus. This data comes from the lower mainland of British Columbia, and it was published today in the Canadian Medical Association Journal. It suggests a vast majority of the population has already been infected at least once. The researchers relied on blood samples taken throughout different waves of the pandemic, not for people who knew they had COVID, but just people going in for blood work for different reasons. And they combined that with healthcare data to look at severe outcomes. Now, what they found was by last July, more than 80% of kids and younger adults had been infected and had a low risk of hospitalization and death. But the picture remains quite different for seniors, and in particular, the oldest adults. The researchers found more than 40% of people aged 80 and up may not have had an infection yet, while having the highest risk of hospitalization and death. So to put a number on that, their most recent data showed 1 death for every 80 newly infected seniors aged 80 and up. Scientists say the study really shows that first-time infections can still be a risk for that age group. Take a listen.
There has been a decrease in those severe outcome risks, but for the older segment of the population, it's still a meaningful risk to them, and particularly for those who have not yet been infected, which is a substantial proportion of the population.
Now, the authors also told me that you can really gain robust protection if you've had prior infections as well as vaccination, but that doesn't mean that people should rush out and get infected. The big takeaway for seniors, I'm told, is for them to stay up to date on COVID-19 vaccinations, including the updated shots that are rolling out this fall. Here's what one doctor told me.
There is a real recognition here that age is probably the simplest and easiest thing to target, and you know, it's one that probably needs to be kind of front of line in most of these campaigns moving forward.
Now, of course, if you are interested in getting a COVID-19 vaccine and you have questions on your eligibility, how to time it, doctors recommend speaking to a primary care provider or your pharmacist. Lauren Pelly, CBC News, Toronto.